Hello everyone. In today's lecture, we'll talk about causes of heart failure. First, let's talk about heart failure with reduced ejection fraction, which is basically this is systolic dysfunction. Systolic dysfunction refers to systole, which is that phase of the cardiac cycle where the heart contracts and ejects the blood out. So in systolic dysfunction, the heart can not squeeze enough, therefore it will not eject as much blood as it is supposed to meet the body's oxygen demand. Why this happens? Because these cardiac muscles, they get weakened due to some underlying diseases. It is basically the heart muscles that contract together, causing this squeezing motion of the heart and pumping out the blood. So now what happens if some of these heart muscles they die off? Obviously they wouldn't be able to contract as hard and they wouldn't be able to give that squeezing motion due to which the heart will not eject blood as much as it used to. If we compare this heart, which is the normal heart, with this one, you can see that this is of a very normal size and the muscles are healthy. However, in systolic dysfunction, the heart muscles are very thin and weak and the ventricles are way bigger. One of the most common causes of heart failure is ischemic heart disease or coronary artery disease. Coronary arteries supply blood to the heart itself. For example, this is the coronary artery and these are the cardiac muscles, and the cardiac muscles are getting blood from the coronary arteries. However, if this coronary artery is blocked by a plaque, then it will not supply enough blood and oxygen to the cardiac muscles, and eventually the cardiac muscles will die off. Your heart has 4 valves. 2 valves separating the upper and lower chambers, and 2 valves that are separating the lower chambers from the venous and the arterial system, from where the blood goes into the lungs and body respectively. Normally, the valves allow the blood to go from the upper chamber to the lower chamber and then they close. However, if there is regurgitation, which means that the valves do not close properly and they allow the blood to flow back from the lower chamber to the upper chamber, due to which we lose some of the blood that was supposed to be pumped out. To compensate for this, the heart muscles, they work harder. But in heart failure, that's the whole thing. The more it works hard, the more oxygen it requires, due to which more cardiac cells die off. Similarly, if there is valvular stenosis, which means narrowing of the valves, the blood has to be pumped out through a very small opening. And it's going to be a lot harder for the heart to pump blood through these small openings. And the same way as regurgitation, the heart has to work harder to supply more blood, which means more work, which equals to more oxygen that the heart cannot supply, and more cells die off. Cardiomyopathy is another cause of heart failure. If you break down this name, cardio means heart, myo means muscles, and pathy means disease. So the disease of the heart muscles. The cause with these is usually unknown. However, there are some examples like peripartum cardiomyopathy or ischemic cardiomyopathy. In general, they tend to weaken the heart muscles, making it hard to pump blood. Next is arrhythmias, which means abnormal heart rhythms. This could be either too slow, maybe too fast, or even uncoordinated, which means that the chambers of the heart do not contract at the same time. Either way, all of these lead to decreased pumping efficiency of the heart, which means that there is less blood supply to the body. And in the same way as we have discussed before, the heart works harder to compensate for this less blood ejected, but it couldn't get more oxygen, due to which there is further death of cardiomyocytes. Myocarditis, also known as inflammatory cardiomyopathy, is caused by certain viruses. It is the inflammation of the heart muscles, and it causes heart failure due to dilated cardiomyopathy or cardiac arrest. Another cause of heart failure with reduced ejection fraction is high output cardiac failure. High output cardiac failure means that a previously normal heart has to pump high amount of cardiac output, leading to heart failure. Cardiac output describes the volume of blood being pumped out by the heart per unit time. So if the heart has to pump a large volume of blood to meet the demands of the body, then definitely it has to work harder for it, which will eventually lead to weakened heart muscles and heart failure. The conditions that lead to high output cardiac failure include severe anemia, AV fistulas, thiamine deficiency, pregnancy, and severe hyperthyroidism. Other causes of heart failure include thyroid disease, some infiltrative diseases like amyloidosis, sarcoidosis, hemochromatosis, some infectious diseases like Chagas disease, HIV, endocarditis, certain drugs like alcohol, cocaine, methamphetamines, and it could be congenital or hereditary. Next is heart failure with preserved ejection fraction or diastolic dysfunction, which is similar to systolic dysfunction, as in that the heart does not pump enough blood to meet the body's oxygen demand. It refers to diastole, which is that phase of the cardiac cycle where the heart chambers relax and get filled with blood. However, in diastolic dysfunction, the heart muscles are very thick and stiff, so there is very less room for the ventricles to fill. So the ventricles will not eject enough blood because they're less filled in the first place. So the first cause is cardiomyopathy, which is hypertrophic and restrictive cardiomyopathy. And as we just said, that in hypertrophic cardiomyopathy, what will happen? The muscle size will increase. There will be hypertrophy of the muscles. So when the muscles are hypertrophied, there is less room for the ventricles to fill. Similarly, in restrictive cardiomyopathy, the muscles are stiffened. So their compliance is reduced, which means that they cannot stretch enough or expand the ventricles enough to fill the blood in. Another important cause of heart failure is chronic hypertension, that is high blood pressure. So when there is increased pressure in these blood vessels, it is difficult for the heart to pump through these vessels. For example, this is a normal healthy vessel through which the blood can pass easily. However, if a blood vessel is narrowed, it will be difficult for the heart to pump against these narrowed vessels. So the heart has to work harder, so it becomes bigger and bigger to pump against these hardened vessels. Both obesity and diabetes contribute to increased blood pressure, so they're also kind of contributing to heart failure. Finally, we'll talk about the valvular heart disease, for example, aortic stenosis. We know that the heart pumps blood out into the body through aortic valve, right? But if this valve is closed, then it will be difficult for the heart to pump blood through this narrowed opening towards the body. Therefore, the heart will start working more and it will gain up muscle to push the blood against this narrowed opening out into the body. Remember that all these conditions can also cause systolic dysfunction, but unfortunately the underlying mechanisms as to why in one case these conditions lead to the growth of muscles, like in diastolic dysfunction, and in the other case they might lead to serious weakening of muscles, like in systolic dysfunction, are pretty complex, and a lot of these mechanisms are still unknown and under research. That's it for today. I hope you liked the video. Take care. God bless you all.